can feel it. Sometimes I feel it and then what I hate is when I do one side perfectly and I come to the same location on the other side and I don't get it the first time.
So with dogs you can advance the needle all the way through until you get to the level of the 4th premolar, which is a carnassial, like that. In cats you can't do that because their orbits are really, really close. So I always like inject and pull out a little bit and then hold and put their head up like that so it dribbles down. Yeah.
So cats you would only go into like...
I would literally be like
just
that.
at the entrance.
Yeah, just at the entrance because you can stab them in the eye otherwise. Yeah.
Jesus.
Yeah, which is never a good look. No. And then the other block that you can use is the caudal maxillary block. And for that one you have to bend the needle like this. Okay, and then...
So this is really if you're worried about that you're not going to get enough coverage through your molar extractions.
Yeah. And then you basically go sort of caudal to the 2nd molar there.
Caudal to the 2nd molar.
Yeah, and you go up like that, and then you deposit your local there. And again in cats you have to be careful because you can stab the eye from the back as well as hitting the maxillary artery too. So yeah, that one that's if you think you're not going to get the canines, the carnassial and the molar teeth. Okay.
But you're pretty confident from how far back we can go in her and that you tilted her head that we'll get coverage.
She's a little
so let it run.
If it's not there, call me back and I'll...
Then the other one that we use is the mental nerve block. Okay, so that's only if you're going to take out incisors.
Which is very common.
Yep, so the mental nerve runs okay, so there's three mental foramens. There's the rostral, middle, and caudal, okay? And you want the middle one because it's the largest one. And it is usually distal to the 2nd premolar here. Sorry, ventral to the 2nd premolar. So it's around this area. And you can, in larger dogs, feel it much better. You can sort of feel it in her. There's like a little dip there, like right there.
Oh yeah, I can feel the little,
you have to
almost like a fossa.
Yeah, exactly. So you can either go from the outside, like this, and this one you can't actually enter the foramen, you just have to sort of inject around it. So I usually just inject around it, and then you do the same thing, kind of hold it there. Or the other way to do it is like, especially if they got very fleshy mouths, is you can actually go on this is a frenulum here, which is the attachment. You can actually go down through the frenulum and deposit it that way. Okay, so that's the mental nerve block. Then the other one is the mandibular.
This is the one where I'm always poking and going, am I putting it in the right place?
Yeah.
So you feel your notch.
Yep, so you feel your notch, and then you can feel the nerves sort of rolling under your thumb there.
You should actually feel them. Yeah.
And then, so you want to, the nerve is basically directly dorsal to the notch.
So there's my...
Pardon?
Notch. So you're actually being able to feel. Oh yeah.
Yep. And you can feel like the nerve bundle sort of rolling under your fingers. Yep. So once you feel that, so then you basically put it directly parallel to the mandible, but you want it sort of angled towards the bone.
I've printed the label. I haven't cut them all into halves.
Okay, they need to be cut into halves, and they're if you go in the dispensary, bottom shelf.
And the other way to do this one too is you feel the fossa from inside, okay? So you can actually feel the fossa on the inside there.
You most commonly will go...
In small animals I usually go outside. In large dogs I will go from the inside. And you can, it's just a little indent there. Just distal to the this molar, the lower carnassial.
Oh yeah. Oh yeah, I feel it now.
Yeah. So, and so,
Get your finger in there, can you see?
Yeah, and feel it.
It's very small because she's a very small dog.
Yeah, and then you basically want to be feeling at the same time, kind of thing. So it's hard because she's so small, and then you basically put the needle in and angle it downwards along the bone there, like that.
Yeah.
And then same thing. Then
eyes come up a little bit. I might just put it on too. Is it actually feeling loose or just her eyes come up? There wasn't that before.
yeah, and then the other one that you do is the palatine nerve block, but then we probably won't do it very much because it's more for palatal surgery.
Palatal surgery and
Yeah, but the landmarks are between the distal root of the carnassial. So draw a line across like there to the midline. So midline's there, and then it's right in between that line and that point and the midline, around there, and you inject down like this. You would put the needle down and then
this is
inject
more
to there.
for surgery or
Yeah, like soft palate surgery or
maxillary
stuff like that. But you would be, yeah, you have to be very careful because you can hit the greater palatine artery and then you'll piss blood everywhere.
Alright,
Okie dokie.
So you're blocked up.
You're all blocked up,
Doggy on
doggy.
that side.